Hello everybody. HIV/AIDS, as we all know, is a sexually transmitted disease which is crippling mankind at a very fast pace. Due to the social stigma which is attached with this disease, affected as well as the general population hesitate to discuss openly about this topic. The best way to deal with this condition is to spread the awareness by discussing this topic boldly with everyone, including family member. With this brief discussion, I would now like to throw some light on this topic. For descriptive purposes, AIDS can be broken into A. Acquired, something that is not inherited. I. That is immune, the body's immune system which fights diseases. D. Deficiency, not functioning properly. And S. Syndrome, the signs and symptoms of illness. Ways in which one can be infected with HIV: unprotected sexual intercourse, from pregnant mother to the delivered baby, use of unsterilized needles in medical facilities, unsterile tattoos, sex workers. They are the major cause for spread of HIV infection as they have multiple sex partners. Use of the same syringe by injecting drug users. Piercing is fast catching up as a style statement by the youngsters. It should be done at a professional center where proper sterilization methods are used. Soft targets for HIV spread are the truck drivers, as they are away from their partners and in searching for sexual pleasure they visit the sex workers. Now coming on to the laboratory test for HIV infection. Starting with is the anonymous testing, in which no name is used and a unique identifying number is provided to the individual undergoing investigation. Next, the confidential testing, in which the person's name is recorded along with HIV results. The name and positive results are reported to the State Department and the Centers for Disease Control and Prevention. Results issued are only to the test recipient. The blood detection tests, in which comes the enzyme-linked immunosorbent assay or the enzymed immunoassay. Radioimmunoprecipitation assay or indirect fluorescent antibody assay, polymerase chain reaction, and Western blot confirmatory test. Now coming on to the clinical features of HIV, starting with stage 1, which is the primary. Stage 1, which is the primary stage, includes short flu-like illness, usually lasting for 1 to 3 months, persistent sore throat, rashes. Coming on to stage 2, which is the asymptomatic stage, in which there are lymph nodes enlarged, the level of HIV in the blood drops to very low level, and the CD4 count is 200 cells per millimeter square. Then is the stage 3, which is the AIDS related complex. The symptoms are mild, the immune system deteriorates, and there is an unexplained diarrhea lasting longer than a month. There is persistent chronic fatigue, weakness, opportunistic infections like candidiasis, burning sensation. Next comes the stage 4, in which the HIV is get converted into the acquired immunodeficiency syndrome. The immune system further weakens, the number of opportunistic infection increases, and death is due to uncontrolled or untreatable defects in immunity. Now coming on to the treatment of HIV infection, lifelong commitment to antiretroviral drugs and supporting patients to adhere to a daily regimen. Second, adequate health infrastructure including health staff. There should be supply of chains of effective drugs, and there should also be a widespread awareness of the value of testing and subsequent treatment. Coming on to the ways of protection against HIV, to start with is the safe sexual practices by using condom, use of fresh disposable syringe, the sterile needles should never be shared. There are some myths regarding spread of HIV by hugging, sharing foodstuff, sharing utensils and shaking hand, which are not true. Now coming on to AIDS education, by educating patients who are affected with HIV, we can ask the patients to maintain proper oral hygiene. The patients should visit dentist as well as general physician regularly. The patients should take consultation to manage HIV associated oral lesions like candidiasis and aphthous stomatitis. In case of any doubt regarding HIV AIDS, one may contact the 4-digit number 1097, which is toll free. And one more thing that has to be kept in mind is that myth regarding the facts about HIV AIDS doubles the complication. Moving on with the education, we can help people to cope with the trauma of HIV positive test result. We should inform HIV positive people about the nature of HIV and AIDS. We should help them to confront any discrimination they may face as a result of being infected with HIV, and we should enable them to lead normal life. Finally, concluding this topic, we should remember that AIDS does not discriminate caste, creed, race, religion, educational or social status. Prevention of AIDS is our joint responsibility. Education and awareness is the only weapon in our hand. Let us accept the challenge to fight against AIDS. We must support and care for the people with HIV AIDS with compassion and understanding. Thank you.